Pap smear or Pap test is recommended for every woman after 21. And why it's so important? Because it can detect abnormal cells in the cervix. And cervical cancer is very highly preventable and highly treatable at the early stages. That's why our aim is to detect abnormal cells in the cervix, to detect and to find cancer as early as we can. And Pap test or Pap smear doing this. How it is done? It is done during pelvic examination. During pelvic examination, a gynecologist takes sample from cervix, usually with brush, gynecological brush, and test these cells under microscope. That's the idea. And here is important question: if Pap test and papilloma test are same? They are not same. They are different things. Pap test examines abnormal cells and finds abnormal cells in the cervix, and papilloma test finds if there is viral infection, papilloma virus infection, because HPV or human papilloma virus is highly correlated with cervical cancer. So they are related, but they are not same. Pap test finds abnormal cells, papilloma test finds if person is infected with papilloma virus. Because if there is abnormal cells in high percentages, it happens because of papilloma virus. That's why these both tests are related, and these both tests are interconnected, but they are not same. Now let's say Pap test interpretations. What means when, if test is negative, it's very desired result. So if Pap test is negative, that's what we want. It's optimal. It means that there is no atypical cells. Mildest form is ASC-US. And what means ASC-US? It means atypical squamous cells of undetermined significance. And what it means? It means that yes, there are several atypical cells. You can see these pink colored cells. There are several atypical cells, but we can't say if they are cancerous or precancerous or dangerous or just variation of normal. We can say how dangerous it is, but it's very mild abnormalities. So usually it's very mild condition. That's why usually it does not require any further treatment, and repeat test after 6 to 12 months is okay. In this case, it means watchful waiting. So if test result is ASC-US, usually most common practice is watchful waiting, just waiting further what will happen in future, and retest and repeat test after 12 months or after 6 months. It depends condition. Second, more important is ASC-H. It means that yes, there are atypical squamous cells, and they can be high risky. They can be we also can't define exactly if they are cancerous, but they are high risky cells. That's why it's more important condition, and it requires further investigation. And what is further investigation? It's colposcopy. Colposcopy means examine more closely cervix. Cervix is lower part of uterus. You can see this is uterine. This is lower part of uterus, and it is cervix. And colposcopy means visualize this part of cervix closely. So colposcopy is recommended at this case when there is ASC-H or atypical squamous cells, but with high risk, high degree of dysplasia. So colposcopy and sometimes biopsy. They are during colposcopy, doctor can do biopsy also if needed, if he finds or she finds abnormal part, abnormal tissues, can biopsy. So ASC-H requires colposcopy and biopsy. That's action, and according to this colposcopy results or biopsy results, we will get next steps. Another finding is squamous intraepithelial lesion or seal. And what means seal? It means that there is abnormal cells, there is intraepithelial lesion, but this lesion is mild. Usually it corresponds scene 1. Scene 1 is classification of tissue damage of cervix. And what it means, you can imagine cervix tissue like this. This is upper part of cervix surface, this is inner part, and scene 1 means that only 1/3 of the it is called lower part, only 1/3 is affected, only 1/3 is abnormal. It's very mild lesion. So usually here management is watchful waiting again, because it's not serious condition. Sometimes, in many cases, it's reversible at all, so it can be reversed itself, so no need any specific treatment in many cases, but it requires repeated tests after 6 months or after 1 year. It's important. More serious and more severe finding is high-grade squamous intraepithelial lesion or H-seal. This H-seal is important finding, and it means that we have more serious damaged intraepithelial lesion, and it means that this damage is more massive, and it corresponds scene 2 or scene 3. It means that this damage is more than 1/3 of the epithelium, and sometimes it affects whole across whole this epithelium, and sometimes it's scene 3 also. So this high-grade squamous intraepithelial lesion is more serious condition. It always requires further investigation, because sometimes full thickness of epithelium is involved, sometimes there is precancerous condition, and sometimes there is cancer also. That's why it requires more attention, and it requires colposcopy, biopsy, and treatment. And what are the treatment methods? Most popular treatment method is loop electrosurgical excision procedure, or LEEP. It's very practical and it's very common procedure. It is done with local anesthesia and remote damaged tissue. It's usually very effective in scene 1 and scene 2. And with LEEP you can do biopsy also. Cryotherapy is another method. It means freeze the abnormal cell with liquid nitrogen. It's also effective, but not as effective as loop electrosurgical excision procedure. That's why it is done less commonly, but still effective. And main disadvantage here is that you can't do biopsy with cryotherapy. And cone biopsy is most serious intervention, and it means that you're removing cone-shaped piece of tissue from the cervix, and also its treatment and is for diagnosis both. So more serious intervention is called biopsy. That are 3 most common treatment of scene 2 and scene 3. So this, when we say this 3 scene, we mean that how cervical epithelium, how much affected with these damaged cells. Now let's say more serious and more severe conditions. There is atypical glandular cells. If there is atypical glandular cell, it's rise suspects about cancer, and it's a big problem. So it requires further investigation as soon as possible. Or there is squamous cell carcinoma or adenocarcinoma. In Pap test, there can be visualized such cancerous cells directly sometimes, and if there is cancerous cells, it requires treatment as soon as possible, and surgery, radiation, and chemotherapy is treatment. In early stages, there is very good prognosis in both cases, squamous cell carcinoma and adenocarcinoma. 5-year survival is more than 90%. So it's very highly managed, and in many cases also curable disease. That's why early intervention is crucial here. That's why so important Pap test. So remember to do Pap test every 3 years after 21 up to 65. Thank you for your interest. Thank you for your watching. If you like my videos, please thumbs up. If you like my channel, please subscribe. Thank you very much. Bye for now.